Imagine waking up one morning and noticing a small, painless lump under your skin. At first, you ignore it, thinking it's just a pimple or maybe a bug bite. But days go by, and it doesn't disappear. In fact, it seems to be getting bigger. You start to worry, what if it's something serious? Should you rush to the doctor? Will they cut it out? Or is it safe to just leave it alone? If you've ever found yourself in this situation, you're not alone. Cysts are incredibly common, and almost everyone will have at least one in their lifetime. But how do doctors decide what to do about them? Should they watch, drain, or remove a cyst? Today, we're diving deep into the world of cysts to answer these questions and help you understand what really happens when you visit your doctor with that mysterious lump. Let's start by understanding what a cyst actually is. A cyst is basically a closed sac-like structure that can form anywhere in your body. It's usually filled with fluid, pus, or other material. Most cysts are benign, meaning they're not cancerous, and they often don't cause any symptoms. But sometimes they can become painful, infected, or just plain annoying. The most common types you might encounter are sebaceous cysts, which form under the skin, and ganglion cysts, which often appear near joints like your wrist. There are also ovarian cysts, breast cysts, and many others, each with their own quirks. So, you've found a cyst. What happens next? The first thing your doctor will do is take a detailed history and examine the lump. They'll ask questions like, how long has it been there? Has it changed in size? Is it painful? Is there any redness or warmth? These questions help the doctor figure out if the cyst is likely to be harmless or if it might be infected or something more serious. Sometimes they might order an ultrasound or other imaging to get a better look inside. Now, here's where the decision-making starts. Not all cysts need to be treated. In fact, many cysts can be safely left alone and simply watched over time. This is especially true if the cyst is small, painless, and not causing any problems. Doctors call this approach watchful waiting. The idea is simple. If it's not bothering you, there's no need to bother it. Your doctor might ask you to keep an eye on the cyst and come back if it changes in size, becomes painful, or shows signs of infection like redness, warmth, or pus. Sometimes cysts even go away on their own without any treatment. But what if the cyst is causing discomfort, or you just don't like the way it looks? That's when doctors might consider draining it. Draining a cyst is a relatively simple procedure that can often be done right in the doctor's office. The area is cleaned and numbed with a local anesthetic, and then the doctor makes a small incision to let the fluid or pus out. This can provide immediate relief, especially if the cyst was painful or infected. However, it's important to know that draining a cyst doesn't always get rid of it for good. The sac that forms the cyst is still there, and it can fill up again over time. That's why some cysts come back even after being drained. So, when do doctors decide to remove a cyst completely? This is usually reserved for cysts that keep coming back, are very large, or are causing significant pain or other problems. Removal is a more involved procedure, but it's still usually done under local anesthesia. The doctor will make a slightly larger incision and carefully remove the entire cyst sac, which reduces the chances of it coming back. In some cases, especially if the cyst is in a tricky location or if there's any concern about cancer, the doctor might send the cyst to a lab for further testing. Now, let's talk about some of the factors that influence a doctor's decision between watching, draining, or removing a cyst. One of the biggest considerations is the risk of infection. If a cyst becomes red, swollen, warm, or starts to ooze pus, it's likely infected. In these cases, doctors often recommend draining the cyst to relieve pressure and remove the infected material. Sometimes they'll also prescribe antibiotics to help clear up the infection. However, if the infection is severe or if the cyst is very large, surgical removal might be necessary. Another important factor is the location of the cyst. Some cysts, like those on the face or neck, can be more noticeable and cause cosmetic concerns. Others, like ganglion cysts near joints, can interfere with movement or cause pain when you use your hand or wrist. In these cases, even if the cyst isn't dangerous, removal might be the best option to improve your quality of life. On the other hand, cysts in less noticeable or less bothersome locations can often be left alone. Patient preference also plays a big role. Some people are perfectly happy to live with a small, painless cyst, while others find them distressing or embarrassing. Doctors will always take your feelings into account when deciding on a treatment plan. If you're worried about a cyst, don't hesitate to talk to your doctor about your options. They can explain the risks and benefits of each approach and help you make the decision that's right for you. It's also worth mentioning that not all lumps are cysts. Sometimes what looks like a cyst could actually be something else, like a lipoma, a benign fatty tumor, an abscess, a collection of pus, or in rare cases, a cancerous growth. That's why it's so important to get any new or changing lump checked out by a healthcare professional. They have the training and experience to tell the difference and make sure you get the right treatment. So, what can you do if you have a cyst? First, don't panic. Most cysts are harmless and don't require urgent treatment. Avoid squeezing or popping the cyst yourself, as this can lead to infection or scarring. Keep the area clean and watch for any changes. If the cyst becomes painful, red, or starts to drain pus, make an appointment with your doctor. And remember, if you're ever unsure or worried, it's always better to get it checked out. In summary, the decision to watch, drain, or remove a cyst depends on a variety of factors, including the size, location, symptoms, risk of infection, and your own preferences. Doctors use their knowledge and experience to guide you through the options and help you choose the best course of action. The next time you find a mysterious lump, you know exactly what to expect, and you'll be ready to have an informed conversation with your doctor. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and explanations. And remember, your health is in your hands. Never hesitate to ask questions and seek the care you deserve.